What fertility tests do I need to be thinking about if I've been trying to conceive for 1 year? It's important to consider both the male and the female when looking at baseline fertility tests. It's important to know whether a patient has a normal egg reserve. We can measure that in the blood with a blood test called anti-Müllerian hormone, which is often abbreviated to AMH. And this is a blood test that gives you an understanding of the ovarian reserve. It doesn't reflect someone's egg quality. It doesn't also tell us about your ability to conceive naturally, but what it does tell us is the store of eggs normal and appropriate for your age? Now you can also assess that with ultrasound. Ultrasound has been around for many years and it's an excellent way to diagnose and identify fertility problems, but you can also count the number of small follicles that are in the ovaries when we do an ultrasound scan. And this is one of the fertility tests I'll be looking at with patients when they first come into the Evewell. But we mustn't also forget the male patient. Men will come to the clinic and perhaps never have done any tests. So we always talk to them through our administrative team here to make sure that they've thought about doing a basic semen analysis. It can feel quite awkward having to come into a clinic and produce a sample. So we also sometimes talk about avenues to do those tests either externally, but we prefer a test done here if we can bring the patient in. It's a much more straightforward and more accurate way to get good results.